જય જયંત દેવેન્દ્રભાઈ.
Hi, Rajendra.
વંદમી આજે જોઈન થવાના છે કે કેવી રીતે છે?
Yeah, she's preparing. She's talking today, actually.
Okay, yeah.
A little confusion, but clarified. And I'm just sending a message to Badane. WhatsApp just
But I think તો પેલા weekend ની હિસાબે I don't think so that people will join, but yeah, whoever can join.
Remind me to this, but I think they will. Let's just see.
હા, મેં જોયું તો WhatsApp મેસેજ તમે રિમાઇન્ડ કર્યું હતું બધાને કે આજે છે કાલે છે, બટ આ તો પેલું ક્રિસમસ વેકેશન જેવું કહેવાય ને, people will be right. એટલે એકચ્યુઅલી તો હવે કદાચ હવે આપણે બે જ હોય તો પછી વંદામી આવીને કે ખાલી લેક્ચર રેકોર્ડ કરવા જેવું થશે.
It's okay if it's record any content. I don't know where to fit it in otherwise.
Yeah, definitely.
Miss me with throw clarification. Just remind people to make an effort. Long weekend છે એટલે
હા, એટલે આ ને આવતું વીક છે ને એટલે એ પછી આ પેલું આખું બધાને વ્યવસ્થિત રીતે છૂટી મળી જાય છે ને એટલે ઘણા બધા લોકો ઓકે.
It's human nature.
Vanda means yeah.
Human nature.
Vanda Sami Samniji. शुरू करें?
Yes, Virginia. We can get started, yeah.
Yes. Hello everyone. Today we are going to discuss about especially we will practice actually and the mudras and the pranayam which are helpful for the problem of thyroid. So about the problem of thyroid, Dr. Devendra has already explained from medical point of view how it happens and where it is happening in our body. So just we have to see that it happens especially in the throat. There is a thyroid gland and parathyroid gland which is located in our throat. So whenever we are practicing any pranayam or any mudras, they must have some relation with our throat and thyroid. So we will practice today. Just I will discuss, and we side by side we will also practice the same. So let me share first what we have to practice. Okay, so there is Praksha therapy for thyroid problem. And what is that? So today we will discuss especially mudras, which are the hand gestures, and pranayam, breathing exercise for thyroid wellness. So since thyroid is related to our throat and it is located inside the throat, so the location for the thyroid problem is throat region. According to yoga tradition, the element of thyroid, especially the throat, is considered as Akash Tattva. It is a space or ether, you can say. So it is a space element or ether element. And there is particular sound therapy for throat problem also. So it is hum sound. So it doesn't represent any religion or a religious what we say deities, but it is a simple the sound hum, HAM. So it is called Bij mantra for especially for this particular Vishuddhi chakra, which is known as center of purity in Praksha meditation system. So this is this Bij mantra can also help us to come out of such kind of problems. So we can chant this mantra also. But if somebody is not interested in mantra meditation or sound therapy, they can practice mudras and the breathing exercise and also the physical exercise, which will be discussed by Ramesh Parmar tomorrow. So this whenever we get this problem of thyroid, then there is communication issues, thyroid dysfunction, and also fear of expression happens in the patient. How we can harmonize? So there are several ways to harmonize the thyroid function or thyroxine, which is the hormones of the thyroid. So there are several ways in yoga tradition. So chanting is also one way, pranayam is another way, and there are some hand gestures through which also we can cure our problem, and there are certain physical exercise too, and meditation, of course, affirmation and meditation. So today we will practice some mudras and some pranayam. So among the mudras, first of all, the first mudra is called Varun mudra. It is especially for Vishuddhi. It is also known as Vishuddhi mudra. So we have learned about Varun mudra, in which we touch the tip of the thumb to the tip of the little finger. So everybody knows about it. Okay, it is the Varun mudra through which we try to hydrate our body. So the same mudra is also for thyroid problem. Okay, so this is very simple mudra. Everybody can do that, keeping all the three fingers and middle fingers straight. You have to touch the tip of the thumb with the tip of the little finger. So keep other fingers extended and relaxed. And the duration for the practicing of this particular mudra is suggested as 15 to 20 minutes daily. Whenever you are seated, you are sitting without doing anything, you can do this kind of mudra, and you can also especially focus on this particular hand gesture if somebody has this kind of problem. Therapeutic rationale is that it stimulates throat chakras and supports thyroid function. And there is a contra indicators. So there is none which is known, and just whenever you are practicing, you have to practice it gently without giving any pressure or harming or hurting anything. Okay, so now it is clear. This is very simple mudra, which is Varun mudra, which is known Varun mudra, and it is also known as Vishuddhi mudra when we are focusing on thyroid problem. The second very important mudra is called Shankh mudra. So we also know that Shankh is a conch and how it is shaped. So similarly, we have to shape our fingers. So here we have to wrap the fingers of the right hand around the left thumb. So you all have learned very well this mudra. So everybody knows it. So they can this kind of mudra can also be done. So in this particular mudra, touch the right thumb to the left middle finger, and duration is 15 minutes daily. So for all mudras, at least 15 to 20 minutes are suggested for practice. So what are the benefits of doing this kind of hand gestures? So it is said that it balances thyroid hormones, calms the nervous system. Contra indicators, so avoid if hand tension or arthritis is present. So so we have to be careful of if somebody has such kind of problem, then they have to see how much they feel comfortable. They have to practice that much only. The next mudra is Pran mudra. So Pran mudra is also very simple. In this particular mudra, we touch the tips of the ring and little fingers to the tip of the thumb, keeping other index and middle fingers extended. The time is suggested 15 to 30 minutes for this particular mudra, and the benefits, it boosts vitality, supports glandular and immune function. So contra indicators is not known for that. It means you can do anytime, or it means everybody can do it. So this is what is Pran mudra. So it is also very simple. We touch the tip of the thumb with the tips of the little and ring finger, and keeping middle finger and the index finger extended or straight. So everybody knows this is called Pran mudra. All have already practiced it so many times. So it is nothing new for you, but it is very helpful for thyroid problem. Now there is some pranayam which is known as Ujjayi pranayam, which it can also help us. So we have also learned Ujjayi pranayam, in which we inhale deeply through the nose while slightly constricting the throat, and exhale slowly. We can exhale slowly with a soft hissing sound. So this is also we have practiced before, but today we can also practice. So here the therapeutic rationale behind this practice of pranayam is that it stimulates thyroid, calms vagus nerve and mind. What are the precautions? So avoid if you have low blood pressure or dizziness. So for those people who have such problems, they can avoid this kind of practice. Otherwise, someone can do it. So Ujjayi pranayam is done with the hardening of the throat muscles when we are breathing in or breathing out, and whenever we are breathing in and out, we make a soft hissing sound. So we can practice this after our discussion. Now we would see that there is one next pranayam which is called Bhramari pranayam. This pranayam is also very simple, and we are doing this pranayam whenever we are starting meditation, or we have also learned separately. So in this particular pranayam, we close ears with thumbs, eyes with fingers, inhale deeply and exhale while humming like a bee. So the benefits of this pranayam or breathing exercise is that it reduces stress, balances hormones, soothes the mind. So all these benefits we can get by practicing this simple pranayam, which is primary. And precaution, practice in a quiet space, avoid if ear infections present. So these are the precautions which we can keep in our mind when we are practicing. And any other okay. So these two pranayams are very important, and three mudras which I have discussed, prana mudra and shankha mudra and the varun mudra. These three mudras are very important for addressing the problem of thyroid. So now we can practice some pranayam. Vishuddhi, what we say, Ujjayi pranayam, and also the Brahmari pranayam, and mudras are already known to you. I think things are very clear. If somebody has any questions, they can ask, and we can discuss some little bit more for today. I think this much is enough.
Vandami Samniji, just the pranayams is also practiced for 15 to 20 minutes?
Yes, very good question. See, if somebody has problem, then he has to focus on for 15 to 20 minutes. Otherwise, whenever we see that if somebody is having such problem, then they are always suggested that at least you have to practice pranayam for 15 minutes, but not in the beginning. You can increase it as you feel comfortable. Not on the very first day you have to practice that much. Okay, if you are finding that there is benefit in the problem, then you can increase till it is completely removed. But one can start with 5 minutes and then can increase the time.
Samiji, can you do mudras and pranayam together? Like, can you hold your fingers in, like, say, Varun mudra and then do the Ujjayi pranayam at the same time?
See, as I have already said, that whenever you are practicing anything, your focus should be completely on one thing rather than on other things. Okay, it is not. It is not
multitasking.
Yeah, it is. It is not harmful. It is not harmful. But just I'm saying that when your mind is focused on that particular mudra or particular breathing exercise or meditation or affirmation or mantra, then it will work properly and it will be more effective. It is, if you do all the 3-4 things you can do, but and your mind will not be focused on any of the 4.
Thank you,
so you are doing everything half-heartedly, so it will not give that much benefit which you are looking for.
It's buy one get one free, Samiji. This is America.
Okay, so Pari, you can do Gyan Mudra. So yeah, Gyan Mudra can also be done. It is especially Gyan Mudra is for brain function, but for thyroid, whatever is suggested, we have to focus on that.
In terms of time, Samiji, the other, and I probably should emphasize it in the talk, that we should also talk about prevention, because a lot of people have family history and the risk of having thyroid but don't have it yet. Also preventing thyroid, maybe you don't have to do 15 minutes, maybe you could do a 5-minute something to prevent it from getting the disease.
Correct. Yes. For prevention, everybody can do that who is completely healthy, has no problem. Instead of that, he has to practice. So that kind of problem should not occur in future. But those people who have already the problem And if it is severe, then they have to practice in a proper way. Whatever time is suggested, they have to practice that much. But they cannot start from day one and that much. They can just start with 2 minutes, 1 minute, how they feel comfortable, and then they can go on increasing the time of practice. Any other question? Okay. So Ujjayi Pranayam. So we have already practiced it, but we need some more practice for learning it properly. So whenever we are breathing in, just we have to harden the throat muscles a little bit, and we should feel that we are breathing in actually through our throat muscles. You are using those throat muscles and creating the humming, hissing sound when you are breathing in or breathing out. So it will give some, you can say, some exercise or some massage to your thyroid. Is it okay? Should we practice it? Okay. Breathe in and breathe out. Yes, so when we create the sound of hissing, sometimes we feel khasi inside the throat.
Samani, when we breathe out, do we breathe out through our mouth like last time?
Actually, those who were talking last time, they were saying like this, but it is not necessary. And the throat muscles should be used when you are breathing out, and you can breathe out through nose.
Okay.
Okay. But mouth is not a problem. Anybody can do, but the whole respiratory system is connected with our nose. Okay.
Right.
So when we are releasing carbon dioxide, it should come through nose and not through mouth. If there is some kind of toxic gases which are inside the mouth, they can come out of it.
Okay.
Yes, the another version can be like when we are breathing out, at that time we can create the sound through mouth, which can look like the hissing sound in true sense. Now the Bhramari Pranayam. So we know Bhramari Pranayam, we breathe in and create the buzzing sound. So that sound should come out of this junctional part, but through throat. This time we are practicing for thyroid problem. So we can just create this sound through throat. So this is a Bhramari Pranayam, so in which we can put thumbs in the ears and fingers on the eyes, nose and mouth are clear, open, okay? So just create. So we can repeat at least 9 times and go on increasing if we have more time. Our attention should be on the thyroid, that its function is becoming normal, the hormones is becoming balanced, hormone secretion is becoming balanced. So thinking that way, if we are focused on thyroid and practicing this kind of pranayam, so it can help us to come out of such problems. So mudras are clear. Varun mudra. Okay, so this is the Varun mudra. It helps to hydrate the body, to keep the body hydrated, and it also helps in thyroid problem. Clear? And this is the Pran mudra. So it is also helpful for thyroid. Keeping both the fingers straight and yes, touching the tip of the thumb with the tips of the last two fingers, the ring finger and the little finger. Yes, correct. All are keeping videos closed so I cannot see. Yes, correct. Okay, yes, okay. And Shankha Mudra, we know how it is done. Yes. Yes. Okay, so this is the Shankha Mudra, which is also helpful. Okay, so it also places the points here when you do this. Yes, correct. Keep fingers touching the thumb. Straight. Yes. Clear? So it looks like the crunch, white crunch, is it? Yeah. So this is the Shankha Mudra. So because its shape is like the throat, is it? The bottom part looks like the throat, no? So it also helps for thyroid. Correct. Yes. Keeping fingers straight, okay? Just, yeah. Now it is done. So there may be some more mudras and some pranayam. I will put it in the PPT and post it in the particular today's talk, and everybody can see from there also. But for today, I have chosen just 5 things: 3 mudras and 2 pranayam. Okay.
And the mantra, Swamiji mentioned, we should practice that maybe just for
Yes,
sound.
mantra. So now we can practice mantra. It is just a sound, okay? Don't worry that it is pertaining to some deities of particular religion, okay? Nothing is there. It is especially the mantra for the chakras, to awaken the chakra energy. So for awakening the Vishuddhi chakra, which is located inside the throat, there is seed mantra Hum, H-A-M, Hum. Correct? So now we can chant for 9 times at least the Hum mantra. Keep your attention on the throat, so you can keep your eyes closed and your mind should be concentrated on thyroid. Yes. Keeping both the hands in the posture of knowledge, or you can say the posture of the Pran Mudra, or you can choose the Varun Mudra. So you can keep both the hands in that mudra, and we have to create the sound and feel the vibration of the sound inside the throat, especially on thyroid, and see that how thyroid is becoming balanced or cured. So now we do Hum mantras for 9 times. Hum, 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 hum. This sound is produced with the support of the throat muscle, okay? There are certain places for producing the particular letters. So according to Indian grammatical rules, the hum sound is produced with the support of throat. That's why it gives massage to the throat. Okay, so this hum sound is important for throat problems. Clear? So it can be also visualized after uttering it 2 minutes, 3 minutes, as you like, and then you can try to visualize the hum sound inside the throat, especially on thyroid. So it is perceived or visualized in white bright color, okay? So it will help to create such kind of vibrations, powerful vibrations, which help in our thyroid problem. Okay, so anybody wants to know or ask? Otherwise, today we can practice meditation. There are a contemplative meditation also for general health purpose. So that contemplation I will post on the Google Classroom. So that can also be done for any kind of health issues. So that contemplative meditation also helps us to control our diseases or to keep our body healthy. And there are certain meditations. Just if we are giving some massage to our throat. So tomorrow Ramesh Parmar will talk about all these things. So you have to just give some massage, some taping. So that also helps our body functions. Okay, little. So in old age you cannot do many hard exercise, but we can do taping anytime. Okay. So tapping also helps for blood circulation in that particular area or particular part, and sometimes there is some blockages or some toxic elements. So it can help to delocate from there. So tapping is also very good. Nowadays people are suggesting that only by tapping you can be very healthy. Okay. So
can we add to the subtle exercises?
You have to tape everything. Your brain, if your brain should function in the proper ways, then you have to give some tapping in the brain. If you want to bring glow on the face, then also you have to tape little bit. So every day at least 4 or 5 minutes. So this tapping is very simple exercise, but it keeps body healthy.
Can we add it to the subtle? Can we add that to the subtle exercise as another?
Yes. Of course, you can. Yes. You have also suggested very good exercise and things in your presentation. So if you want to give that to all, that will be good. Yeah. So you are talking?
No, I was thinking that we just have to structure a way to fit it in our schedule.
Okay.
And I was thinking that if we can, let's say we're gonna have somebody who has thyroid concerns, you could build this in the subtle yoga, and maybe you can sort of package it for them, so that's their package, with some adjustment, because they can't do anything. They can say, well, how much time do you have? And we'll talk about it in the last few weeks. How do you customize to your patient's needs? But you could, you kind of have to package it for what their time they have. They like to keep up. Then you could probably pick even a routine that they're willing to follow, that would like to be able to follow. So I was thinking this might be one to fit in early in the subtle exercise, because it seems to go along with the subtle exercise, the tapping.
Yes.
I was more like that, because we just have to figure out where to put this in. Although there's so much to tell them, but when we make our card for each disease, we can put that in there. That you could add this in subtle, because eventually you're going to have one card or one for each disease, each possible things you could add, like the mudras and mantras and color and exercise. And then there we can then put this in so that they could have that to remember as they apply.
Correct. Yes.
So we'll go over it again before I make the final cards. These are good things to put in there, so they become a practical tool. They can just pull out the card and go over for their person. Here's something you may want to try. Then we do personalized medicine, which is what we are. Everybody's so different. Then we can say, for you it's this, for you it's that. And that, I think, is one of the things that would be a good part of this, is to have the ability to personalize it to an individual for their physical deficits, time deficits, there, then this would be good ones. I think this is a good one to add that we hadn't added. I think tapping is a good one.
Yes, tapping is very good. Yeah, so it makes the part especially active if it is dull or there is some numbness or there is no proper blood circulation or energy flow, then tapping will help us to come out of those problems.
Yeah.
Yes.
That was all. I was just saying that, I'm just mentally trying to prepare those cards. There's really good things to add.
Yes.
Yeah. This is Rakesh Bhai's idea, but I think it's a fantastic idea. We'll have to have a data at the back, and then each thing will be like an infogram with at the back with the data to convince people that the plots, and this will be all the information what the trainer can teach them, and maybe even give them to practice so they can get their copy. They can practice.
So card would be separate for all different diseases, or?
Yeah, I think so. I think we already used to give them like a PowerPoint with just one page, like a poster with image. But I'm thinking that we can just each one print it. I can print very. We can just have the front page with all the acharashis and yours and Ramesh's, all the postures, like we said, put in there all these details. The back side we can have the few plots, the data to support that medical data. The research, so like the plots and some papers, articles. So the back, all the, even from the arguments, but anything that suggests this is why it's important, we put that in the back. Do this and what the evidence is, what the data shows, what the research shows. And then on the front side, we have what the package is. And then once you train somebody, give that to me at the end, like here's your package, so you can practice that.
Got it.
That might be a good thing. I'm thinking good thing for people to have, become like a template.
So you can start creating at least one sample so we can see.
Yes. I'm working on one. So I'm working on one, and I'll show you. And then anyway, Ramesh does most of the work in the sense that what you taught today and his yoga, he puts into one big thing already that we did them before. Each time we did this, remember the 4 or 5 day programs we did before? We had created those for each one at that time. Each time we created one page with all the steps. The Om chanting if it's secular, the color, the chakra, then the mudra, then the pranayam, Preksha will add, and yoga. All of them we already had been creating them even last time before. We just have to create them for new ones we haven't done, like women's health. We haven't done that, so we're going to make those. So we'll show it to you. But it's something we did before, but we didn't put the data at the back. So we have one page, and then because what happens when people come to you, can show them that, right? You already have it.
Yes.
And so I think that's a marketing thing. Just a discussion from Rakesh. He just came up. That would be a good idea. I think just popped up that the plots and infographics look very important. That's what the marketing people do when they come to our office to market a medicine. They have to show us a plot. They don't have time to tell us a lot, but they can show us the plots from a good research.
Correct.
And then we can make a judgment. Well, this medicine may be a good one to try. So I was thinking that's a good marketing idea to actually have it like that and help your clients. So
very good. Yes. When we start doing anything, then automatically some ideas, vision come into play, and we can develop those kind of things so people can easily pick up the things or follow the things. Okay, so now I think everything is clear. Today there was only mainly the practice and not many more discussion, because the Dr. Devendra has already given detailed lecture on thyroid problem. So he is authentic person for that. Now, so we have to practice meditation. Sit in comfortable posture. And who is ready to give the session today? Sheetal, yes.
Samani.
Yes.
So we're going to start with recitation of 3 Arham mantra, and then we'll go into the meditation.
So, yeah.
Do you want me, Vandami?
At least the 5.
5. Okay. So take a deep breath in and say the word Arham. We'll do it 5 times. Inhale deeply. Resolution of meditation. I am practicing Preksha meditation for the purification of my psyche. We will repeat this 3 times. I am practicing Preksha meditation for the purification of my psyche. I am practicing Preksha meditation for the purification of my psyche. The first step of meditation is Kayotsarg, relaxation. Keep your body steady and relaxed. Keep your body stable like a statue. No movement at all. Suggest your body to relax. 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 Suggest your feet to relax from your toes, your sole, your ankles, the calf muscles, the knees, the thighs, and the hip joint. Feel the relaxation in both your feet. Relax, relax, relax. Suggest your body to relax the middle portion, the lower abdomen, the stomach, all the internal organs. Relaxing relaxing, relaxing. Suggest your back, the lower back, the mid back, and the upper back to relax. Your shoulders, the arms, and your hand. Feel the relaxation in the center part of your body. Suggest your neck, your mouth, the nose, the eyes, and the facial muscles to relax. 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 Suggest your top of your head and your brain to relax. Feel the entire body is completely relaxed. 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 The second step of meditation is Antaryatra, internal journey. The consciousness functioning with the gross body, which activates the mind, the speech, and the body. Concentrate your mind at the Shakti Kendra, bottom of the spinal cord. Take up your mind to the Gyan Kendra, which is the top of the head, through your spinal cord. Again, bring your mind down through the spinal cord back to the Shakti Kendra. Undertake the internal journey of your mind from the bottom to the top and top to the bottom of your spinal cord. Experience the subtle vibrations of vital energy through your spinal cord. Keep your conscious mind completely inside the spinal cord. Synchronize your breath with your conscious mind. While inhaling, bring your conscious mind from the top to the bottom, from the Gyan Kendra to the Shakti Kendra. And while exhaling, take your conscious mind from the bottom of your spinal cord to the top. Continue your practice. Feel the energy rising from your Shakti Kendra to the top of your head. Moving to the third step of meditation, perception of psychic colors. Bring your consciousness to the middle of your throat, Vishuddhi Kendra. Perceive bright blue color near your throat, color as bright as the neck of a peacock. Bright blue color. Concentrate your conscious mind at Vishuddhi Kendra. Experience the bright blue color particles surrounding your body. The bright blue light has surrounded you. Inhale the blue color. Experience with each breath, bright blue color particles are entering inside the body. Inhale deeply. Exhale slowly. Feel the blue particles entering inside your body. Experience the bright blue color particles are emanating from the Vishuddhi Kendra and spreading all around your body. Visualize and experience the bright blue color. Your aura is filling with the bright blue color particles. Experience your urges are pacifying. Your biochemical urges are pacifying. Keep your focus on your Vishuddhi Kendra and experience the bright blue color particles, pacifying your urges. Fourth step of meditation, perception of center of enlightenment. Concentrate your conscious mind at Jyoti Kendra, situated in the middle of your forehead, and perceive bright white color there like a full moon. Sorry. Experience your forehead is filled with the bright white light like the full moon. Spread your conscious mind throughout your forehead and perceive the bright white color there. Visualize the full moon in the middle of your forehead and experience the peace and bliss. We will take 3 long breaths and conclude our practice. Inhale deeply and exhale slowly. We will recite the Om mantra 3 times. Om. 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 We'll rub our palms and gently put it on our eyes. Gently open your eyes.
Thanks. It was wonderful session. So, and it was also matching with our talk of today.
Yes. Perfect. Perfect and
So,
perfect.
yeah, so this is the meditation also, which is helpful for thyroid problem. In the hospitals, we see the curtains either in the green color or in the blue color. So blue color is also good for health also, and the green color for detoxifying the toxic elements of the body. So these 2 colors are considered medically very good for at least for those people who are having health issues. So it was matching us. Okay, just I sent one message through WhatsApp before 2 days or 3 days that I need feedback from all of you for the course which is going on currently, and just to create a news for a souvenir. So it would be better if you can provide just in 4 or 5 lines how you are perceiving this course, how it is beneficial. Okay. So just give me the feedback today, please, so that because we have no time for publication. Okay. So, thank you.
Great. Tomorrow at 9 o'clock.
Yes. Paul are getting the videos of the, what we say, camp, 38th camp.